Okay guys, in this next part of the correcting upper body dysfunction video, home exercise program, we're going to go through and look now at the stretching or lengthening techniques. So we've done our release techniques, we've done our mobilization techniques, we've done those. Now we're going to lengthen those muscles that we addressed as being short and overactive. And again, we're going to now take them to a new length. We're going to try and optimize that length of those muscles. Okay, so we're going to take them out of that shortened position that they're in, and again try and return them back to the normal or optimal length. Okay, so the ones we're going to go after, only two stretches to go for really here. So the first one I'm going to show you is the child pose. So that's mainly going to address those big lat dorsi muscles. So they're the ones that's going to contribute to that arms fall. They play a huge role in contributing to that arms fall sign. So one of those main signs of dysfunction for upper body. So that's what we're going to go after first, and I'm going to show you the child pose stretch. And what this also does, this stretch does hit quite a lot of muscles. It also gets those rhomboid muscles. So if you remember when we did that release technique between the shoulder blades, it will also get the levator scapula. So that muscle that tends to get really tight and irritable in the kind of like in that kind of cervical spine, in that kind of neck area. So it's going to get that. It's also going to get some other muscles like our subscapularis, which sits on the underside of our scapula, which it's hard for us to get with, we can't really get in there with a massage ball or foam roller, just because of the position where it is. It's we kind of have to go through our almost like through our armpit to get there. It's not going to be very nice. There are some tools you can use to get in there, but that is a little bit more specific. Normally we need like a bit of manual therapy to release those. So, but again, we're going to address what we can do, and we can still lengthen that muscle as well by doing the child pose, because again, that muscle does rotate the arm in. So we can still get this with this stretch. We can also get a little bit of posterior deltoid as well when we do this. So for the child pose, what we're going to do, you've probably seen this before, it's very straightforward. We're just going to sit our backside back towards our heels, or as far as it can go. Doesn't matter if you get stuck here, that's fine. We're going to go back as far as we can go, and all you're going to do is you're just going to reach out in front. Okay, and again, you can place a little pillow underneath to rest your head on it if you want to. That's absolutely fine. And I'm going to reach my arms out in front, and what I'm also going to do is I'm going to turn my thumbs up to the ceiling. And the reason I'm doing that is because if I do that, we're going to rotate our shoulder joint out, which is called external rotation. And our lats, so these big lat muscles, they're an internal rotator. And again, it's those internal rotators that are really driving that arms full sign. So if I do a bit of external rotation by putting the thumbs up, that's going to help to lengthen them and stretch them even more. Okay, so I'm going to reach as far forward as I can. I'm going to try and lock out my elbows, rotate my thumbs up, and again, I can just look down and hold it there. Now all I'm doing is I'm just going to go to that first point of stretch. Okay, so that first point of tension, and I'm just going to hold it there. Okay, so that's the position I want to be in. I'm just going to hold it there, keep it still. Okay, and I'm just looking to hold these for, again, 30 seconds to 2 minutes. So I'm going to go to that first point of stretch. Okay, that first point of tension. So it's a bit like the release technique. You should just feel, mildly uncomfortable. I should have mild tension there. I'm going to hold it. First point of stretch. I should be able to be comfortable there. I can hold it all day. I can breathe. I know I'm not kind of fighting it. I'm not kind of sweating as I'm doing it. I can just get into it. Get comfortable, wait there. I'm going to hold it until that tension starts to go away, so that tension starts to calm down and relax. And as soon as I feel like that release has happened, I can then move on. I could go a little bit further. I can try and stretch a little bit further and go to the next point of tension and hold that, and wait for that to go away, then move on. Or I can just get that first release and then move on. So again, we're just looking for that first point of tension, that first point of stretch. We're going to hold that stretch. Should just be mild tension. Wait for it to go away, and then we can move on. So that's our first one. That was our child pose stretch. The other one as well, with that child pose, I should have mentioned before, we also do get some pec minor. So that's that muscle that we release with that ball kind of in this area. So we do get that too, because as we're doing those arms up, we are making the scapulars rotate upwards. So remember all those muscles, like that muscle, that levator scapula, that muscle up in the neck, the one between the shoulder blades, and that pec minor, the one in the chest, all cause that downward rotation of the scapula. So the child pose does get in and hit those too, but we can get into the pec minor a little bit more by using our foam roller. And what we're going to do, we're going to lay back on it just like so. So we're going to lay long way. So you will need like a long roller to do this. So again, I'm going to get comfortable, make sure my head's supported, my back is supported, and my pelvis is supported on all on the roller. You might want to bring your feet a little bit wider just to get a bit more stability. And all you're going to do is you're just going to put your hands just behind your head right here, okay? If you want to progress it, you can bring your hands just kind of onto your temple a little bit more, just on here, okay? And I'm just going to try and let my elbows kind of sink back down to the ground, okay? Again, just holding that position, and what that will do, that will start to lengthen my pec major, also my pec minor as well, because what I'm doing here in this position, as I start to bring those shoulder blades kind of back closer together, that's going to help to promote that tipping backwards of the scapula. And also I've got that upward rotation with my arms up in this position, which are both of those actions are going to help to really lengthen that pec minor. So again, just going to take it there. I'm going to go to that first point of stretch. Just going to hold it there so it's comfortable. Again, I'm just going to wait 30 seconds to 2 minutes, or until I feel that tension start to go away. I can't really feel that stretch anymore, and what I could do is I could just push my elbows down a little bit further, go to the next stretch, and again repeat the same process. Okay, so that's our stretching or lengthening techniques. So we did the child pose, and again the child pose will more or less hit everything that we did with those release techniques. Going to get the lat dorsi, that pec minor, that levator scapula up here, those rhomboids sitting between the shoulder blades. It will also get a little bit of posterior deltoid too, and it will get that subscapularis muscle, which I mentioned, which we can't really get to. It will get that. Again, we can also do that kind of pec stretch to kind of get into that pec minor a little bit more. So that's our lengthening techniques, okay? So again, we're doing these to take those shortened muscles that are contributing to those signs. We're going to now take them to a new length and optimize their length. Okay, so that's what we're doing. That's our stretching techniques. And then in the next video, we're going to go after those activation exercises, those activation techniques. So those muscles that are the opposite. So the muscles that are long, the muscles that are underactive, the ones that just aren't working, the ones that aren't firing, okay, the ones that we need to work in order to maintain optimal posture and have optimal movement. We're going to be firing those ones up next. So I'm going to show you how to do that in the next video. So look out for that one. Take care.